Right.
Like, you're a mess.
Pooping should not be so anxiety inducing.
So I made a video, and I will show the video. I made a TikTok video when I was first diagnosed, when the trial first hit. It went viral. Big news in the cancer world, especially for colon cancer. A cancer center in Manhattan just came out saying that they had a 100% success rate in their trial of 18 people, and their cancer was completely gone, and they were put into remission, and they all had various stages of rectal cancer. This is incredible, and the technology is very similar to the trial that I was asked to be in. This is giant, and the minute I saw the news, somebody tagged me, and I immediately started crying. This is hope. This is great. This is hope for all of us. Welcome to MandaTalks.
Light up, light up, light up.
Yeah. My name's Amanda, and I'm here with a very special guest. This is Jessica.
Hi.
She is the one and only beautiful survivor that I asked to join in person. This is my first in-person interview, everybody. I'm pretty stoked. Jessica, go ahead and just remind me what stage you were and what year you were diagnosed.
So I was diagnosed in January of 2024 with stage 3 rectal cancer at 29 years old. I turned 30 in October.
Congrats.
Thank you.
Congrats. So why I really needed Jessica here today, because Jessica is part of the Sloan Kettering trial, which is just revolutionary. And I remember reading about it years ago, and just my jaw was on the ground. They use immunotherapy, which is really incredible. Instead of attacking cancer cells with chemo, they're using immunotherapy. So I've asked Jessica to come and tell us all about it. So give us the rundown. Where was it? Where did you do the trial? Just start off.
I didn't know anything about immunotherapy before I was diagnosed. I went in thinking I'm gonna have to go through chemo. I knew people that went through chemo, and that's what I thought happened when you had cancer. And so Memorial Sloan Kettering in New York.
Kettering.
They did a clinical trial and released the data 2021. This whole thing,
Yeah.
it was like, and so when I met with my oncologist, so guidelines are based on Lynch syndrome, my biomarkers, all of that. Instead of chemotherapy, we go with immunotherapy. And I was
Wow.
like, what? All I've ever heard was chemotherapy when it came to cancer.
Wow.
So I had no idea what that meant. Like, can we dumb this down? And they tried going through it and I said to my oncologist, like, okay, let's do that again, but even more simplified. And so basically my oncologist said to me that rather than attacking the cancer with chemo, the immunotherapy would basically help my body do what it doesn't naturally do because of Lynch syndrome.
So I won't go over Lynch syndrome in this video. I'm only going to go over immunotherapy that Jess received. The reason why is because immunotherapy is not chemotherapy. And in order for her to have received this special type of immunotherapy, she had to have had Lynch syndrome. So I'm going to go over that later in another video, specifically what Lynch syndrome is. But just so you know, Jess does have Lynch syndrome, and that is what made her a qualifying factor for this trial.
One of the very niche things about immunotherapy is that you have to have a very specific biomarkers.
Yeah.
So they said this thing to me that I had. My mass was mismatch repair deficient. Mismatch or MMR, then it's D. Now, knowing about Lynch syndrome and what that meant, my body doesn't fix mismatched cells as they develop and then develop into cancer cells.
Gotcha.
So since it's mismatch repair deficient, it's missing that automatic to fix itself.
We'll go over Lynch syndrome more in another video, but what you do need to know about Lynch syndrome in this video is imagine your DNA is like construction instructions, and the person who's putting together the building doesn't have all of the instructions, decide to make up some instructions on their own. That is a very general concept of genetic mismatch mutation.
Gotcha. And this is exactly why she called it a roadmap, right? Because you wouldn't have known that you had Lynch syndrome unless you got that genetic testing.
Right.
Right? It's less known, but it's
Very common.
but it's more common than BRCA.
And there's so many it's Lynch syndrome, but then there's PMS2, which is the one I have, or there's MLSH, MLA6, like there's like a bunch of variations of Lynch syndrome, all impacting the risk of colorectal cancer, endometrial cancer, skin cancer, all differently.
And that's a great thing that you're bringing up, because Lynch syndrome is not just affecting colorectal cancer. No. And I think that we kind of attach it with colorectal cancer a lot because that's the main cancer.
That's where it's picking up momentum. I think that's where they're making the connections. But having Lynch syndrome, that was my one way in, my ticket in. Like, what made it credible. That validated my experience and my symptoms, and that's an advantage now that I'm aware of, that I have, because I can say like, we're gonna do a scan, like, full stop. I'm not even gonna take the chance.
Good for you.
Yeah.
Be like her, okay? Bitches.
It takes time. So, interesting thing about insurance with the trial. The drug is on the market. Mm-hmm. So that's really the piece that they need the connection to. My oncologist did have to send in, like, we joked about like a thesis basically of why I needed this. She needed to plead to the board insurance,
or whatever.
Yeah, that this was the medication that I needed.
Let me explain, okay? We got to break it down. Technically, a version of the drug is on the market right now, and it's called Keytruda. You've probably seen commercials for Keytruda. It's currently approved for 18 different cancers, including triple-negative breast cancer, uterine cancer, but the type that this doctor in particular has created was not Keytruda, but Keytruda is what is FDA approved. So here are 3 alternative immunotherapy drugs that are out right now. You see the top one on this list says that it's similar to Keytruda. The one that we're talking about right now that Jessica did is the bottom one. Jessica did the JEMPERLI. That is the one that she was able to get approved through her insurance, and she was able to have, and that is the one we are currently talking about for her specific type of biomarkers. So now that we've kind of broken that down, it's a sister drug, but it's not technically the same drug. Got it?
Got it. It got approved, but she said to me, like, I was going to fight them anyway if they told me no. And that's another important thing. Have an oncologist that's got your back. Her team's got your back. I didn't have to speak to insurance once. Knowing that there is another option of Keytruda that is similar enough that I think treatment times and stuff might change a little bit, like length of time. But for the most part, my oncologist is comparing them like a Coke to Pepsi. So if they say, no, you can't have dostarlimab or JEMPERLI, dostarlimab is like the official like science name. Keytruda also can be switched out. There's a possibility depending on, because everybody's body is different. Yeah. And so
colon cancer progresses over a long period of time. So a lot of times people can go back and recall symptoms that they had for a long time. Let's talk about some of Jess's symptoms.
And we're doing the math going back, and I was like, yeah, I was diagnosed at 29, but like 23, 24 is when symptoms really started, but it was like bright red blood. So people were like, hemorrhoids. And then it was like, oh, like you have like weird like cramping or like, you know, change in bowel movement. Oh, it might be what you're eating, or it might be, and it was very dismissive until I got to the point where I was like, I can't, there's no way that this is normal. Yeah. Like there was no way that I was just having IBS symptoms anymore. Yeah. And even if I was, like,
you can't live like that.
This isn't comfortable.
Right?
I don't like this.
I tell that to people all the time with IBS, like, just go see a GI.
Yes.
Like, you're miserable. Go see a doctor.
Right.
Like, you're a mess.
Pooping should not be so anxiety inducing.
Never. Like, you're a mess. If I'm talking to you, go talk to your GI.
Yes.
Okay, so let's go back to immunotherapy.
So when we talked about it, she said to me, like, I'm going to be upfront with you. Like, you're the first patient that I have that I am administering this specific drug to. So my oncologist in San Diego is following this clinical trial done at Memorial Sloan Kettering, 3,000 miles away. And we're kind of just learning together. You won't be like enrolled in the trial because I can administer the drug here, but we're going to follow it.
Wild.
Yeah. And so people have said to me now, like, how did you not run out of that doctor's office? And I was like, my relationship with my oncologist, I was like, she's got me.
You have to.
I had no questions from the beginning, from the first time I met her. I was like, she's got me.
It's clear that
Oh yeah, you'll know.
you trust your oncologist with your life.
Yeah, and that's like I saw 2 oncologists. I saw somebody before her.
You gotta vibe with your oncologist, okay? If you don't vibe with them, get another one. It's really common to change oncologists if you aren't really vibing with them or if you don't think your cancer treatment is up to date. A lot of times, older oncologists have older treatment plans. So if you want somebody who has more of an active treatment knowledge, then I would probably choose a doctor or an oncologist that's more of like a scholar. They're up to date on trials and stuff. And that's kind of why we're making this video. That way you have this information to take to your oncologist.
So she told me about the 18 out of 18 patients at the first round of the trial.
18?
18 patients in the first one.
Crazy.
All 18
We're cancer-free.
Cancer-free and didn't need surgery.
Wild. Every single one.
100%, okay? Like the odds of that are like 1,000,000,000,000
Yeah.
and one or something like that.
100%. I remember. Yeah. It was revolutionary.
Yes, groundbreaking.
Yeah.
It's now one of the FDA's like breakthrough treatment therapies. I mean, they did another round again after that, and the same thing. All of the patients responded well, and and I think the thing that's even more promising is now they're looking at into remission. Like
What happens?
they've all
long-term?
gone a year, 2 years with no recurrence.
What?
Yeah. I was ready to take, like 80%. You know, that was
Yeah.
like, okay, that sounds good. But my oncologist is sitting here telling me 100%.
100%. Those odds sound crazy to hear.
It's science. Like science isn't always 100%.
It's never
you know?
100.
Like, you are taught in science class, like, things happen, placebo effect, like all of this stuff where it's not always. And so then to hear that, and I was like, okay. And then she was like, but then they did it again. And I was like, wait. And we're still having positive success stories of this. So she said to me, we're going to follow it. So I was like, all right. Why would I say no? Why would I have any kind of, and I had questions about what are my symptoms or side effects or, things like that. The cancer center did their best, I would say, in terms of trying to prep me for things. But I got a lot of, this is what we tell people with chemo, so just follow that.
I can't imagine. I bet it was scary.
Yeah, like I was like, I have no point of reference. Nobody can tell me what they felt, what happens, where does the mask go?
Do you want to tell us? So, yeah, where did the mask go?
Whoa. You got to take a girl out to dinner first before you ask her what happens to a rectal tumor. No, I'm just kidding. We're going to get to it, but let's talk about her symptoms with immunotherapy first.
When it came to like side effects, I'd have my infusion days were Thursday afternoons. And then I'd do the 30-minute infusion, wrap up and everything. And then by the time I got home, I would say probably an hour and a half, 2 hours after the infusion, I started to kind of feel like that night before you get sick, like you go to bed and you're like, just kind of feeling like, a little bit of a headache and I'm kind of like achy. Mm-hmm. And then the next day you wake up like full cold or flu.
Yeah.
That was it.
Oh.
I got to that point where it was like, oh my God, I feel like I'm getting sick. And then I'd wake up Friday morning and be like, okay. I would get the infusion. It was a 30-minute infusion. We started it every 3 weeks for 4 doses, which the way that it like spaced out got us to about 3 months in.
Okay.
So then in May, we doubled the dose and did it every 6 weeks apart instead.
Wild.
It didn't change. It was still 30-minute infusion, which I'm not good at math. That still didn't make any sense in my head, but I was like, you're the professionals. I'm not going to try to think into why it's not being longer, but whatever. We doubled it, and I didn't really notice like amplified like from symptoms or side effects based on doubling the dose. Yeah. I think that, and my oncologist said to me, like, if you have not a great reaction, we can always stick to the 3 weeks single dose.
Okay.
She was like, but we'll judge that based on how your body responds. We started in February, and after my first one, I was like, I feel different. But I was like, placebo effect. This is me just thinking you got medication and you're feeling better. Let it go. And then we did the second dose, and I was like, no, like I feel drastically different.
Really?
Oh yeah, the pressure was gone.
What?
Yeah,
So yeah, where did the mask go?
in the toilet.
Wild.
I had no idea. I had asked my oncologist, and she was like,
It's wild.
Let's see. But yeah, it broke off like tissue. Like when I would go to the bathroom, I remember the first time looking in the toilet, because that was my thing. Every time I went to the bathroom, I was in the toilet.
Same.
Flashlight,
Yeah.
looking at everything.
Oh my God, flashlight too!
Yes.
Shut up! We are
I
literally,
need to know.
I literally am like poking through my...
And my wife is like, you're gonna get pink eye. Get your head out of the toilet. And I'm like, but I gotta see. I need to see what this is. So of course, I go to the bathroom after my first infusion, and I was like, this looks weird. But I was like, my poop has looked weird for a long time, whatever. And then after the second one, I was like, oh, that's back again. And it was just like pieces of tissue, like breaking. Wow. Yeah. But nobody told me that.
Yeah, because you wouldn't know.
I wouldn't know that.
Okay, so
and I asked people, like things just felt like they were moving better, like digestively. Wow. The abdominal pain was gone. Like, I mean, like, gone. And I was like, what? And then after the third treatment, the blood was gone. I never had blood in my stool again.
You're a miracle.
So then I was like
a
this
walking
is crazy.
Magical.
Well, then it gets even crazier, because we did a midpoint check. So we did colonoscopy, MRI at May. After the fourth treatment, the fourth infusion, the mass was gone. Like entirely gone. There was like a little bit of tissue left, but they biopsied and it was just tissue. It wasn't even
What?
Yeah.
They biopsied and everything. There was no cancer cells.
No. So that was 3 months into treatment. I only had 4 doses.
Yeah.
By the fourth treatment, I didn't have, like, there was no tissue coming out in the bathroom anymore. That stopped after the third.
Whoa.
Literally, I know. It's not every day you meet somebody who literally shats out parts of their colon tumor. It's pretty freaking impressive, and it's really crazy. Y'all have to follow her. My next question for Jess was, how do you feel the immunotherapy left you after you finished it?
Feeling then with the clinical trial and doing immunotherapy, I was like, I'm alone in this.
Yeah.
You know, I didn't have access to the patients that had done it in the past, and I didn't know what they were experiencing. I didn't know what things were like afterwards. I didn't know anything. So very obvious 2 symptoms or side effects were fatigue. My stamina, even till now, and my last infusion was August of 2024. Even now is still kind of
you tired.
Yeah, a lot faster, and that's a mental battle, and that kind of.
I'm 3 years out, and I still struggle with it.
The other thing that I think arguably as difficult is the cognitive. They call it chemo brain, but I've been trying to refer to it as treatment brain now, because it happens with immunotherapy too. When I'm in a situation and need to multitask. Yeah. Or like when I'm in a room and I'm doing something and my wife's like, hey, honey, can you help me? And I go, and then I never come back to that thing I was doing, because I literally have no recollection that it exists.
I'm laughing because that's like
literally just poof.
It's very relatable.
Like in cartoons when like all of a sudden it's just like poof. I swear that happens. Like that little bubble, like little dust bubble happens, and I'm like, it's gone. Like,
it never
even
existed.
If I want, having to constantly shift yourself, like it makes it very difficult to be flexible and like, you know, just kind of changing with what's needed, which stop shaming cancer survivors to get jobs.
Literally
right
stop.
away.
Literally.
I don't trust, we have a trust issue now. Like, I don't know when you're not working. I don't know when you need that extra help, or am I, you know, not giving you the right things, or how do I, and it's a lot of this learning yourself. Afterwards, like coming out of it, like through immunotherapy the whole time, like I was able to, despite the body image things with Lynch syndrome, I was able to look at myself and see myself. My hair stayed the same. My hair grew, actually, like really was growing. My skin was very clear.
Oh my gosh, you're mismatched.
Yeah,
gene.
it was, everything was matching. To anybody that does go through immunotherapy, there is a possibility that people forget.
Experience is very, very unique. So this is exciting. Like this is, you know, like when we go to a conference every year in DC and we meet these beautiful cancer survivors, but they are botched, you know, like they are alive and we are very grateful. But if we could have them alive and have their whole body be whole, that would be the main goal.
Yeah, it's quality of life too. It's, you know, I've talked to people that are like, they've got to take like hormone replacement to like build back things, or they have to like, you know, I mean, there's so many things that go into it, reproductive, and especially being at a younger, colorectal cancer rising in younger adults, like why not be able to preserve more of the bodies? Why not, you know, avoid things like neuropathy and you know, sensitivity?
You know, so like immunotherapy versus somebody who would be going through active chemo treatments, this is a better way of life.
Right, absolutely. During treatment, post-treatment, you're preserving so much more. And I think like that's one of the scariest parts for people going through cancer is everything you lose afterwards. And to be able to sit here and say like, I don't have to adjust, you know, to having and being an ostomate and having to change, figuring that out and difference with the bathroom. But it's funny, when I hear other people's stories, it's always a very interesting experience because I have such deep gratitude for immunotherapy. And it's like, I think about all of this things that people that went through chemo experienced, and I mean, and again, immunotherapy isn't always like that. Depends on your body and how things are, and I can explain that too, but it's a very different experience, and I love everything that I was able to keep because of immunotherapy. But at the same time, there's this kind of melancholy feeling that comes too, because then it's like, did I cheat the system, right? This idea, I know, and I can, the other logical side of my brain could be like, no girl, this sucks overall.
Cheat the system. Please cheat the system. We love it. We want you to cheat the system.
Sorry, I forgot to warn you about the dark humor that cancer survivors usually have. Immunotherapy also comes with a lot of trials, and it is very uncomfortable. But I just want to say that the cancer experience of having cancer kind of doesn't really change. You know, you still get the cancer diagnosis and all of that. So that's kind of why we're laughing. I just want to fill you in on our dark humor.
Right.
Keep cheating it for all of us.
Right. And I'm also very much aware of this privilege that I had because...
Let me interrupt really quick because this video was filmed about 5 months ago. And as of right now, this medication in particular has become harder and harder for rectal cancer patients to get their hands on. And it also has had less and less trial research funding it. So this is why I'm making this video, and this is why we are talking about Jess's experiences to hopefully encourage people to hear the science of this trial.
But from what I know from now finding patients that were in this clinical trial, I did find somebody she was the 4th person to receive it. Yeah.
Wow.
Yeah, she's doing great. She's having her 3rd kid.
Good for her.
Yeah, so I'm, you know, there's really no impacts to the reproductive system.
Good.
So, you know, seeing these people now and being able to say like, okay, like, you know, I can see them out a few years out past me and where they are in their lives now. And so, but I think knowing what I know now, I can't be quiet. I can't keep that in. I can't know how little people know about Lynch syndrome and early onset colorectal cancer. And I mean, like, when we're talking like not just peer to peer, like
no one, like even adults.
Yes, doctors not acknowledging that this is happening. Yeah, one thing I say with my oncologist, which tends to sound a bit like shocking or like jarring for people, but it's not a matter of if it comes back, it's when.
Colon cancer doesn't get remission. So when you get diagnosed with colorectal cancer, doctors really have you buckle up and buckle down for having recurrences. I like to tell people that colon cancer likes to have lots of encores.
But knowing that I have immunotherapy as a treatment option really changes a lot. I had the honor, because I think so incredibly highly of her, but I met the doctor that did the clinical trial at
Did you
Memorial
really?
Sloan Kettering. Yeah, her name is Dr. Sursek. She is just the absolute sweetest, most incredible person, but she is just this like regular everyday person that's just a freaking genius but she's so kind and so caring and so compassionate. And I mean, she had no reason to take time to meet me. We did a Zoom call and I met her in person. She had no obligation to do that, but she wants to see the patients that her work is impacting.
Even though Jess had cancer and she went through the whole cancer journey, her experience was different than other cancer survivors. So her battle scars are different than other cancer survivors. So let's talk about them.
They look at you, you don't look like a cancer patient. You keep your hair, you keep your eyebrows, your weight stays the same, like things don't look. And so then I experienced a lot of people forgetting that I was sick. Yeah.
Because you don't even have scars like a cancer survivor. So your battle is completely different than...
Could you imagine living every minute knowing you actively had cancer and you were fighting it, but nobody else knew that you also had cancer? They just thought you looked like a normal, active human being.
So your battle is completely different than any other.
The minute I met Jess, I knew I needed to interview her about this trial because, again, I've been tracking this trial for some time and it's really revolutionary. And I'm so impressed that she was able to do it. But I'm also very impressed that she did it and she went in blind. And one thing that I asked her off camera was, if you could tell yourself prior to taking this immunotherapy, what would you say to yourself? Because this obviously was a huge risk and you really had to trust the science. So what would you say to her?
I often think about what I would say to that girl in January of 2024, like finding out something called immunotherapy was out there and that I was going to be like following this clinical trial like on the side, but not really being in it and like having all of these like big question marks. I think saying to her, like, just like trust it, like just do this. Like, there are other people. I might not know these other people, but there are other people that have done this. Like things like immunotherapy, there are things that aren't that stereotypical cancer experience.
So I'm very, very grateful that I had Jessica here. I feel like I just want you guys to hear her story and really know that there is these amazing, amazing fighters out there that have these incredible stories. And if God forbid you ever become one of them, that we have people who have amazing success stories that you can lean on or come to for comfort.
So I'm on Instagram. My handle is jrayoflight. That's where I put most of my energy, is on Instagram. You can message me through there. There's also a way you can email me too. And I'm happy to share anything. I've always said, like, since cancer, I don't have a TMI threshold anymore, so
it's gone.
I'm open to talking about whatever. And if that's the comfort space that you have, then by all means, please feel free to reach out.
I know it's always really difficult, so I appreciate it.
Of course, absolutely.
The minute I saw her, I was like, oh, I know about this trial. Like, I'm fangirling over you. Like, can I see your rectum? But thank you so much, everybody, and we'll see you later. Bye. Like, did you take pictures of your tumor in the toilet or what?
I wish I did. That's a regret. Picture of the tumor in the toilet. Yeah, that was a regret.